Welcome to Colonie TV, the governmental educational channel for the town of Colonie.
Good morning and welcome to the Senior Resources Show. My name is Cary and I'm the Director of the Town of Colonie Senior Resources Department. I'm glad that you tuned in to watch us today. Today my guest is Nora Baratto and she is the Director of the Case Management Department at St. Peter's Hospital. Hi Nora, how are you?
Good, how are you, Chris?
Good. Thanks for joining me today because we have a very, very serious topic to talk about that certainly impacts our senior community, correct?
Yes.
Okay. We're going to talk a little bit about, I don't know if seniors have been following this issue or have been impacted by it, but the observation status that's fairly new to seniors and it surrounds their hospital stays, and there's been a lot of questions that have come to me through the Senior Resources Department, and I thought it was important to bring in an expert, somebody who works with this day in and day out, to answer questions that people may have already or to give them some knowledge so that they're better equipped when they go to the hospital to deal with these issues. So thank you. So we'll get right into it if that's okay with you.
Great.
Okay. Can you start by telling us a little bit about what observation status is? Because I think it's a fairly new term to seniors.
Observation status is where the doctor will conduct further testing in that, and he's observing the patient, trying to make a decision as to whether that patient needs to be admitted to the hospital or not. And this is fairly, over the last 5 years, that observation has become very popular.
But it seems to have come to a whole new level recently from what I'm hearing from seniors and from professionals in the field. I've become familiar with the two midnight rule. Can you tell me a little bit about what that means?
Well, it's really observation, but Medicare labeled this as the 2 midnight rule for doctors, more as a guide for the physicians to say that if you don't expect the patient to be over a 2 midnight period, then you want to keep them in observation. If you feel that the patient qualifies for inpatient based on their condition, that they feel in their best interest that they meet the medically necessary criteria, and they're going to be conducting tests in that are going to take over 2 days, then they will admit the patient. But the piece that a lot of families and seniors get mixed up is it has to be medically necessary care, and that's the sticking point.
Absolutely. And what diagnoses are typical of observation stays?
Chest pain, digestive problems, UTI, syncope or fainting, sometimes a fractured shoulder, any kind of fracture where it's not really going to require surgery. Sometimes we have pelvic fractures that have been observation.
Really?
And it really depends on the severity. It depends on the patient's comorbidities. If they have, a significant history of heart and cardiac issues and they're diabetic, okay, those are factors that when you look at the total picture, that may require that the doctor admit the patient, depending upon what they're going to do for that. With a pelvic fracture, for example, and this is a common issue that happens, the treatment for that is usually bed rest. There's no surgery. And what Medicare looks at, and the insurances do, is can that be treated in another setting? And most of the time the answer is yes. Mm-hmm. Can be treated in a skilled nursing facility. Sometimes it can be treated in an acute rehab facility. So what the focus is does it require that it can only be in an acute care setting?
Okay, all righty. That's a lot of information for a senior to have to kind of digest as they're dealing with an illness, regardless of the severity or the level of the illness.
And the key is to be very proactive and in conversation with your primary care physician.
Okay. Does the observation apply to all insurances, or is it, if a lot of folks have Medicare Advantage plans now today, and, the whole Medicare piece, I don't know how that all works.
Yes, it does. It applies to Medicare. It applies to the commercial insurances, the Senior Advantage programs. The Advantage programs treat things a little bit differently, and they have that ability to do so. But again, the thing that they need to make sure is that it's medically necessary, and be proactive about it and try and understand and know what your insurance is, and kind of talk with your insurance company about observation, because there's a lot that seniors need to know, and the family, the caregivers need to know as well.
As a health insurance counselor, it would behoove me to start to educate seniors on this when they come in to pick a plan in the fall. It's something that I haven't spent a lot of time looking at, as I'm usually busy helping folks find the right drug plan, the right health plan, but
Right.
this whole observation status and how plans treat it is something that I need to be more mindful as I'm counseling individuals.
I think the elder law attorneys, the community providers, aging providers, there are a lot of resources out there, and this is fairly new. Even the doctors get confused about it. So it is really important to read about it. I know that the nightly news has had many stories on it, and one of the things that does upset me with the nightly news is they say, insist that you be an inpatient. You can't insist. It has to be based on the medical facts and the medical necessity. And the bottom line is the hospitals are caught in the middle, because Medicare and the insurance companies require that we follow their rules. And again, it's based on what's medically necessary.
Is the hospital required to inform patients of this?
Under Medicare, it's not required. However, at St. Peter's and St. Peter's Health Partner, we do notify patients, under Medicare patients. However, in New York State, in January, a law was passed that hospitals now have to require the patient in writing and verbally of what their status is within 24 hours. So I'm grateful that New York State passed that, because
it helps to
raise the awareness.
Absolutely, absolutely, it does. Oh, that's interesting. I'm glad that was passed. How does observation impact a senior from a financial perspective? The cost of care.
If you're out in an observation status, you may have a higher deductible. Observation status is meant only to be under Medicare for 48 hours. So if a senior comes into the hospital and say they're too weak and there's nobody to provide care when they go home, and they don't feel that they can return home, what will happen is, if we have to pursue placement or, a temporary respite, we've got a process that we've got to really get moving on. And most times you can't find a facility or that within 48 hours. So what we have to do is, after that 48-hour mark, if they don't meet for inpatient, then we have to issue them a denial. And under Medicare, the denial, if they agree with the hospital, then the patient has to pay for their stay in the hospital, and then they may be responsible to pay for their stay in a facility. So it really gets very complicated. And the best thing for seniors is to make sure that, they have family or they have a plan. I think the biggest thing I want people to take home from this is it's so important to have a proactive plan. It's so important to talk to your kids or have a healthcare proxy and power of attorney so that you've got a plan in place, because what we see is a lot of people come and they don't have any plan and they're in crisis, and then they're faced with these unexpected financial costs, and it really is upsetting to them.
Oh, absolutely.
And it's very difficult for us to work with them through that process in a very efficient manner, because things take time, and sometimes facilities don't have beds if that's what they choose, to go to a nursing facility. Other times we can get home care to go in, but it's not enough if somebody needs somebody with them 24/7 for those first couple of days.
Yeah, absolutely. And what my next question would be, post-hospital care, when somebody goes home, you started kind of to touch on that with the home care services. How does observation, affect folks once they're, discharged, or they're, no longer going to be in the hospital, can be in the hospital?
Well, most of the time you can access home care, and when we have home care going out into the homes, again, it's a limited time. They go in, their goal is to educate a family member or the patient, to do their own treatments, and to stabilize the situation. Sometimes they're eligible for an aide, but the aide isn't going to be in there 10 hours a day. So generally, we rely on the support of caregivers and people to pay financially if they need an aide, or if they need like an adult day program. Those are all options, and I think that's why it's important to be connected to your local senior services, so you're aware of what services are available to you.
Right.
But there are additional costs.
And I think we're in an environment now where seniors and caregivers really have to recognize that we're living longer, the cost of care, the cost to stay independent is rising, and it really is on the senior or the family to pay for that additional care that somebody may need. There aren't the public programs, there aren't the public services as available and accessible as there used to be. So the financial impact is, I think seniors are really starting to feel.
Yes, we really encourage seniors to be very proactive, to reach out, and a lot of times I have seniors that will be in the hospital and say, well, I'm saving for a rainy day. Well, sometimes that rainy day has already come, and sometimes it's very important to change the mindset of I'm going to hold off because I'm trying to save my money. Sometimes if you're proactive and you pay for some preventative services, you can really be ahead of the curve, and you can maintain control over your own quality of life and your own destiny.
Absolutely. And I talk to seniors about this all the time. I hear so often that seniors don't want to bother their children. Their children are busy. They want to remain independent. But I always feel that if you engage family, as you mentioned before, engage family early, it fosters your independence, because, as you said, when you're proactive and have discussions with your family, they know what your wishes are and how you would like to live at the end of your life or in your later years, and you can have intelligent conversations around what you would like to remain independent and how you're going to pay for that, because it does cost money to remain independent as you age.
Yes, and again, I can't stress enough, there's a growing movement because services are fewer and fewer, and people have to pay for services. The bottom line is what's going to be becoming very prevalent is accessing case managers. And, you know, you're in that role right now at Colonie Senior Services, and you're going to see independent case managers really starting to become more proactive. We have a program at St. Peter's called Choices, and I love the name of the program because what we say is seniors don't think about hiring an attorney if they have legal issues. The way that we have to change our thinking now is you want to hire a case manager to help you navigate the healthcare delivery system and the community system, community services, the entitlements. People don't really realize that they're eligible for things, and they've gone without it for a number of years. Veterans benefits is one. You know, the drug programs. A lot of times people say, well, I applied for Medicaid for my husband and I wasn't eligible. It's different if you have to go into a facility. So the resource levels are different.
Right. We, in our department at Senior Resources, spend a lot of time helping folks with more case assistance. And when we find that they need case management, which we're seeing more and more of, we do refer them to Choices and programs similar to Choices, because we feel that we can still stay involved, but when we partner with an organization like Choices or any other case management service, we're better serving the senior. We have our role and you have your role, and we're able to bring twice as much to the table to help seniors remain independent.
And that's what it's about. Forming those partnerships. What we're seeing a lot in healthcare today, and what we do have at St. Peter's is, and that's funded through Medicare, is the Eddie VNA Coach Program. That's a partnership that we are working with the Eddie on, and for patients that are admitted to the hospital and have a primary diagnosis of heart failure, pneumonia, COPD, we can set them up with a coach to help them for the first 30 days. So there's a lot of health insurances as well that have case management programs now, and they're focused on disease management. But there's a lot of seniors out there that have psychosocial issues, housing issues. You know, some of them are depressed. You know, there's a number of things that don't fit in that nice, neat little box, and that's the beauty of case management is they have that expertise in all that area, and they're going to help them, guide them, and navigate through the system, and it's focused on the individual. It's not focused on what this agency or this insurance company wants to get done. So it's really a thing that I think older adults really need to become familiar with.
Yes, we're here talking about observation status, but really the case management is such an integral part of of how the observation status really plays out. We could almost do a separate show on case management.
You're right.
There's
you're
so
right.
much to cover. There really is. Well, let's talk a little bit about Medicare beneficiaries. That's a tough word early in the morning. Where can they obtain information on Medicare observation?
Medicare has a consumer, if you do CMS or Medicare.gov, they have a consumer website. And in the consumer website, there is information about observation. And it's a lengthy form. It's 12 pages long, but it's in a question and answer format. What we do at St. Peter's is we have to notify, and we do notify patients of what their status is. If they want additional information, they can ask for it, and then we will provide that 12-page form. Some people are overwhelmed and say, I don't want it, give it to my daughter, but we will provide that. The other opportunity to get more information is to call the Senior Action Council. And the Senior Action Council, we have referred many patients to because they don't understand their insurance, they don't understand how it works, and they're advocates, and they will work with them and help them to get the information that they need. And they publish a brochure on observation. And the Centers for Medicare Advocacy has an observation packet that they can get. So again, that's on the web as well.
Okay. Well, we'll make that information available to our viewers. We'll have at least the number for statewide Senior Action Council, because I know they're helping a lot of seniors with the advocacy piece around this issue.
Right.
So it's very important. If a Medicare beneficiary ends up in the hospital, what questions should they ask, and to whom should they direct their questions to?
Well, I think that what they really need to talk about is, what status am I, and their doctor, and not to be afraid to talk to the doctor. I would say you want to be clear in what status am I? Am I in observation status?
And is that something they ask every day if they're there more than the 24 hours? Or?
Yes. Yes, I think that's very important because your health condition can change. And we do have some patients that come in as observation, and then they do continued testing, and they find out that there's something larger going on. So we will upgrade that patient to an admission per the doctor's request. The thing I would ask is, what papers do you need to sign? When you go to sign any papers for treatment, you want to ask, what status am I in? And if there is an observation information, if you are put in observation, you want to ask for that letter in writing, and it will require your signature. And it's not saying that, you know, it's just notifying you of the status. If you can be upgraded, but again, that's something every day, any consumer, and this just isn't with seniors, you need to know and ask if your conditions change and in what status you are, because it impacts high deductible. You know, you have higher deductibles, you have more out-of-pocket costs.
Sure, sure. I can imagine for doctors who are always have been trained more clinically, now they really have to answer a lot of questions that their patients have around the financial component of being in the hospital. It must be unique for doctors to have to deal with when that's possibly a senior's first question. Is there not necessarily what their health condition is, but what's their status?
The important thing to know for physicians, it is difficult because physicians and nurses are trained to care for the patient and not ask the questions about insurance. And this is one thing that I think is really important to know is if you come in your observation and you're concerned and you don't think that you can afford it, the one thing that I need to reassure people of is that there's all kinds of financial assistance programs. And at St. Peter's, we have outreach, Cardin outreach, and then we have financial counselors that will come in. You can ask to talk to them. We do whatever we can to make sure the patient gets treated for what they need, and that we can make sure that we're answering their questions. So they should always talk to their doctor. And if they're not getting that question, ask to speak to a social worker, discharge planner, utilization.
Mm-hmm. And typically the discharge planner, from my personal experience, is involved pretty early into the hospitalization.
Right, right.
So there's opportunities for that dialogue to start much sooner.
Yes.
Yeah, and that's very important. If an individual is, we've touched on this a little bit, but if they're unable to go home because they need continued care, what happens? How are those decisions made? And maybe we can talk a little bit about how social work becomes involved then.
If they're not able to return home, usually they're seen by discharge planning, which sometimes can be a social worker, sometimes it's a nurse, but they know the whole process. And they'll assess their situation. If they need to go to a skilled nursing facility for rehab, if they are brought in as observation, they're not going to be eligible for Medicare to cover that stay in the nursing home for short-term rehab. Medicare has what's called a 3-day qualifying inpatient hospital stay, which means you have to stay in the hospital 3 consecutive nights. And if you do, and it's determined that you need rehab, then Medicare usually pays. But this nuance with observation now, it's passed on to the consumer. Now, sometimes with managed Medicare programs, that Medicare program will waive it and say, we're going to pay for you to go to rehab, because that's important for you to restore your independence and get you back home. So it depends. If you have straight Medicare, the rules vary among insurance. So again, that's why you need an advocate.
Yeah, absolutely. Which leads me to the next question. What appeal rights are there for seniors?
They can appeal to Medicare their status, but what they have to make sure of is if they didn't qualify for an inpatient stay, then Medicare will not do the appeal. There's nothing to appeal. But if they are brought in as observation and they can't go home and the hospital upgrades them for purposes of discharge planning, and I know that sounds counterintuitive, but we have to always have a patient in status. So what we do and what Medicare requires is that we say, okay, we have to admit them because there's no other option, but they're only here for discharge planning. In that case, we give them an appeal notice, and they can appeal right then and there in the hospital, and they're expected to have a decision. And when a decision comes, we always tell them what day they would be financially responsible.
Wow, that's a lot to digest
It
for
is.
a senior who's sick and their families.
Right.
Does a senior need to hire an attorney to do this appeal, or?
No. It's really important, though, that they have, their healthcare proxy, their power of attorney, the people that they trust with their care, and it's very important that the people that they trust with their care speak to the utilization management or discharge planning department so that they can advocate for them and guide them through.
I'm concerned as I'm listening to you talk. Will seniors be nervous about calling 911 if they're not feeling well? What is your advice to seniors that are sitting home and are possibly ill and think they need to go to the hospital but have watched this show and have some concerns about this whole observation status?
I think that what's very important for seniors to know is, again, being proactive the minute you're not feeling well. Sometimes, and even with my own mother, we say, oh, it's old age and that. But really, if you go and you're proactive by going to your doctor, calling your doctor's office, not at 5 o'clock, as soon as you start to not really feel well, let your doctor know. They have case managers, some in the practices now, that they can talk to. Always go. You always want to make sure that you get to a doctor in urgent care, and if need be, and you feel that you really need to go to the hospital, you go to the hospital. But the key is that you be prepared with a plan in the event that you need to stay. 48 hours is a time period where you can be in that observation status, but you need to say to your loved ones, what's our plan?
Right.
You need to contact the discharge planning department and say, I'm concerned. You never want to disregard any signs that you're feeling sick and that, but there are different ways that you can access help.
Well, I think the most important message that comes out of today's show is that seniors need to be proactive and need to plan and engage their families in their healthcare planning efforts so that they can hopefully not have to deal with some of these, what can be very frightening long-term implications.
Right, and it's not very, again, ask questions. And the squeaky wheel, I always say that to seniors, you need to say, I need to speak with somebody in charge. If you're not sure who to speak to, you want to speak to the nurse, the doctor, and ask them for help. And we're very aware of it.
Right.
We've been working very hard with getting the word out, and again, Senior Action Council calling. It's not meant to scare people, but it's meant to help them get the word out, so that they come a little more, informed and aren't caught off guard, because
Absolutely.
that's what really is upsetting.
Absolutely.
To patients and families.
Absolutely. Well, thank you, Nora. We've run out of time already. This half hour went by so quickly. So much more that we could really cover. But we will make your information, your contact information available, and that of Statewide Senior Action Council. So if seniors have questions, they can always contact the Senior Resources Department at 459-5051. And do you have the number there for Statewide Senior Action Council?
Yes, the Statewide Senior Action Council number is 436-1006, and my department number is 525-1364. I welcome questions and concerns, and I look forward to sharing additional information I can with Medicare. The Patients' Rights Medicare Helpline is 1-800-333-4374. And what I would encourage everybody to do is when they call Senior Action Council or you get on their website, they have information about observation as well, and those important numbers to call.
Right, great. Thank you so much, Nora,
You're
for
welcome.
joining me today. And thank you for joining me. We'll see you next time on the Senior Resources Show. Thank you.